The Sisters of St. Joseph came to Minnesota 150 plus years ago to establish a school. Shortly after we were here, a cholera epidemic broke out. Ever since then, we have been involved in healthcare in one way or another.
Minnesota has so many uninsured people. Their income's a little bit higher than what qualifies for any of Minnesota programs, and yet they may be working 3 or 4 jobs and not enough income to pay for health care. So it's the people in that gap that we serve.
We established our clinics in donated space, out in churches and schools.
I've been healthy all my life. I have a big pain around my stomach areas.
I took him to the emergency room.
The place I was working for, they don't have no insurance.
And I just wish I had a job that offered insurance.
The doctor referred me to St. Mary's Clinic.
We currently have a network of 1,200 specialists who see our patients in their office at no charge. We also have 13 hospitals we have contracts with.
We requested his records before we said it was okay for him to come. And he had a calcified mass in his abdomen. And we decided that it seemed like we could get him in, do an MRI, which is what the emergency room wanted done, and everything would probably be fine.
They did ultrasound, CT scan, all sorts of different tests, and they found that he had a golf ball-sized tumor on his pancreas.
I'm almost 32 years old and I never hear anybody my age with something like that.
Worrying if he was gonna live or die, basically.
At that time, my baby was 2 months old and I really don't want to believe it.
So we set him up with oncology then, and we got him his surgery.
About a month ago, I had my surgery.
You're healing very, very well.
Oh, I'm feeling a lot better.
When he went to the ER, the mass they found there was incidental then. So because he had no health insurance, he was feeling well, he would have gone on living his life until at what point that cancer would have metastasized throughout his body, and it would have been probably beyond then being able to do surgery and care for him. They were an incredibly, wonderfully inspiring family to me to have navigated through that, and how wonderful to know that we saw them.
We not only advocate for our patients one-on-one, and that would be really looking for permanent health care coverage, governmental programs they're eligible for, but we need to advocate as a whole for the group we serve and have a movement to really bring forward the issues of the uninsured to those who are policy writers and lawmakers. So we believe health care is a basic human right.
It would probably be one less of our family if we wouldn't have found the St. Mary's Clinic, I think.
I love my family and my kids, so I want to be around for a long time and be able to someday maybe meet my grandchildren.